I was really excited when I saw the LEAPS educational seed funding. I noticed there was a gap in pediatric residents having a comfort around reproductive health care, particularly counseling for folks who are LGBTQ and those of the trans identity. And so my particular proposal was around creating an educational curriculum with standardized patients to increase that comfort and that knowledge and to enhance the language use. Making residents more comfortable using the specific language that they might have to use when encountering folks in real time. So when I was looking at how I was going to use these funds, I sort of looked at the current literature, looked to see if there was any similar programming, similar standardized patient scenarios, or similar use of reproductive health models. And there's great literature out there in the OB world, but not similar funding or similar projects in pediatrics. But a lot of adolescents utilize the emergency room for their reproductive health care. And so there's a huge gap in pediatric training to actually provide GYN visits, to provide reproductive counseling. And it's not part of our standardized curriculum in every program. And having gone to a program that didn't have that specific counseling as part of our adolescent training, I wanted to build that. And so I wanted to build a curriculum that really allowed residents to build that comfort in a safe place that wasn't dependent upon a patient encounter, but allowed them to have it in a, independent of patients and build that knowledge and build the language that they would have to use out in the real world. And so I built a standardized patient scenario, and I modeled it on ones that I had seen in my own work, as well as some discussions that I had with some OB colleagues and some of our community health workers. And so we modeled on that, and then I worked with one of our residents to really build out some of the resources that we would use in conjunction with that. So we've been implementing the curriculum since the beginning of the year. This was a curriculum that we really wanted to start in July with our recently incoming intern class. And so we've actually been able to have every block or every month of residents participate with that. And so about 1 to 2 residents participate every month in a standardized patient scenario that happens actually in our clinic. And they get to, it's about an hour long, an opportunity to meet the patient, do a reproductive health counseling visit, do a physical exam or a GYN exam with a GYN model that we were able to purchase through this seed funding, and then counsel the patient based off of what they encounter in that GYN exam, and then do a debrief scenario with either a nurse or a social worker on the language use that they have, as well as the standardized patient. And so we've had really great feedback. Our residents actually have asked for more and more scenarios. And so we're building out more standardized patient scenarios, both based off of the physical exam that we purchased through this funding, as well as language use, which is independent of the funding. And so we'll be doing more, we'll be building out more scenarios and incorporating them not only into our residency program, but hopefully doing it as part of our clerkships. We've had some opportunities to do this as part of our transition to 4th-year clerkship program, and the 3rd-year clerkships are also part of our future goals. And so we'll be seeing some opportunities for medical students to get involved, as well as some of our older residents. I found that this grant was extremely accessible. It was a great opportunity to build a small project that needed a little bit of funding to make it more well-rounded and push the comfort of our residents a little bit further so that we could get really good data. And I'm looking forward to using that data to push a little bit further. And I'm excited that I can continue using, this funding is going to allow me to build a bigger project after a little bit more time. I'm getting the seed, it's truly a seed funding, and I'm looking at it as a seed for a larger project. And I'm really excited about that. And I would encourage anybody to apply for it. If you have a small project in mind, it's a great opportunity to take that project and utilize the time to build a bigger project over time too.